interested in reducing these areas of fat that are hard to target for most of us.
Yeah, yeah.
And this is your abdomen and the chest area, right? And we're currently doing what is called the Exilis, and the Exilis is a procedure, a machine that was FDA approved about 2 years ago. And it's an amazing non-invasive way of reducing fat. And you can target certain areas that are very difficult to treat. Some people exercise a lot, and despite their efforts, they can't get rid of certain areas of fat. So this is ideal.
Yep.
What it does is it cools, this tip cools the epidermis and the dermis to 10 degrees. And then it delivers the thermal energy where the fat cells are. And those fat cells will leak out their triglycerides and fats into the lymphatic system, and that will be urinated out. So it's important to come well hydrated and drink a lot of water post-procedure. The beauty of this is that, number one, is this painful?
No, not at all.
It's not painful at all. In
It's
fact,
warm.
when I do this procedure on the face for the skin tightening, people go to sleep. I put the music on, and it's very relaxing, and people have a glow after the procedure. So it stimulates collagen production as well. The procedure that I'm doing here in the abdomen is geared to fat reduction. When I want to treat his abdomen, and there's some women that are very thin, and because they have no fat, but they have a lot of skin laxity because they've had multiple children, and like a balloon, the skin goes, you know, it gets very, you know, thin, and it loses collagen and elastin throughout, you know, the years, unfortunately, as we age. So this machine helps tighten and produce collagen. So typically what I do with patients, since nearly all of us can benefit from collagen stimulation, after I do the fat reduction, I follow it with the technique that stimulates collagen stimulation and tightens the skin. And the beauty of this is that, like I mentioned, it's not painful, there's no downtime, and there's only 2 contraindications, and that would be metals in the body, like a total knee replacement, or pregnancy, current pregnancy, or wanting to get pregnant.
Or a heart thing, a pacemaker.
If you have a pacemaker.
Yeah.
Those are the only contraindications.
Now, this is another area here too. I did a lot of weightlifting in teenager, high school, and 20s. A lot of weightlifting, so I have a lot of muscle under here, but it makes it look too large. So I'd like to take a small amount of that area off of here in the near future, you know.
And those are areas that you can target. You can treat sagging arms, women that have, or men that have lost weight, or this area that starts sagging. You can treat that to tighten it. You can treat the jaw and neck area, and that tightens it nicely without any downtime. Inner thigh, I mean virtually any area you can treat with this machine. Are you doing okay?
Yeah, it's great. It's great. It's,
Okay.
It's warm. It's warm.
That's all you feel. You feel warm. And it's normal to get a little bit of redness, and sometimes when I'm treating the stomach, people, you know, their GI system is stimulated, obviously, from the massage, which is not necessarily a bad thing. But,
And the sides too, obviously.
yes, we can target the sides.
Do you have a few hundred customers for the sides?
Oh, yes.
There? I mean,
well, you know, after 40, for females more than men, believe it or not, it's very difficult to, our bodies start to change because our hormones start changing. And we start accumulating fat like men above the waist. And so it's very good to target this area in females.
What other areas are most common for this?
We can do butt, the butt, and there's a certain technique where you can do a butt lift. So you can do fat reduction combined with skin tightening to give it a little lift, and that's very popular. The arms are very popular, and the inner thighs, and the stomach. Stomach and flank is very, very common.
So it's 3 or 4 sessions? Is that
3 or 4 sessions for you to see results. And technically, I'll give you an example. One
Sure.
area is this. So, or this. That's one treatment area.
Sure.
And
It has gotten real warm, like it felt like
Yes.
maybe at some point, maybe 130 degrees approximately, you know,
Yeah.
at some point. But the first minutes, the first 5, 6,
No.
7 minutes were nothing, but the last minute has gotten a little warmer. And so just for sample, how would you do this area if you were to do it? Can I turn on my side just so you can show?
I would have you
sample
turn
on
around.
should I turn this way or this way?
Wait, don't move, because if
Don't
I
move,
lose
okay.
connection, that would zap you.
Okay, so
Yeah, if you, what I
which
would
way
do
should I
is.
turn, this way?
Yeah, you could turn that
Okay,
way.
just to show the camera
that's fine.
a sample of this portion right here, yeah. And I imagine there's hundreds and hundreds and hundreds of people that do these
Yes.
with you the last few
Flank
years.
is very difficult to treat for most patients. Most patients have a hard time.
So that's the name, the flank instead of the love handle, huh?
The love handle,
Yeah.
the muffin top. We
Okay.
have so many different names.
Flank's a better name.
Flank. So it's the same technique,
Mm-hmm,
but it's just a different position
Yeah.
to be able to target this area.
I see. And this could be done once a month or once
No, you can do it every 7 to 10 days.
7 to 10 days.
Mm.
I see.
You know, you're not supposed to do more than 5 areas at a time,
Mhm.
and that the reason for that is that you don't want to overwhelm the lymphatic system with so much fat going through it.
Mm-hmm.
So you limit to only 5 areas per treatment, and you can repeat it every 7 to 10 days. I
And
recommend.
the session time would be 20, 30, 40 minutes, what would it be?
It depends on the area that you're treating.
Yeah,
So for areas, it depends on the area, really.
yeah.
I
Is
usually-
your average session a half hour, or what is it?
The average session is about, if I'm just doing the abdomen, I do 12 minutes.
Mm-hmm.
And because the abdomen typically is, I treated it as one and charge it as one, but technically it is 2.
Yes,
Because most people, whose stomach is this
Yes.
big?
yes. Mm-hmm.
Most people it's 2 or 2.
Mm-hmm.
So I double up the time, and, because I like this procedure, I charge it as 1, and that'll take me about 12 minutes, and then I follow it by skin tightening for 4.5 minutes of skin tightening.
Mm. For my friends and family and viewers' information, you were full MD at Kaiser for many years, correct?
Yes, I went to UCSD as an undergrad. I went to Stanford for medical school, and then I did something unusual. I did an MBA at USD, and then I did 3 years of residency at UCSD. I worked for Kaiser, and then kind of got discouraged with my specialty and just medicine in general.
Mm-hmm.
And took off a year, traveled, and then decided to do a new specialty through the American Academy of Anti-Aging.
Mm-hmm.
And that's where I got interested in aesthetics. I was doing a fellowship in anti-aging and regenerative medicine, and there was a conference in Las Vegas, but they had no modules for me, but they had aesthetic modules, and so I started delving into aesthetics, and I loved it.
Mm-hmm.
Are you feeling too much heat?
No, it's fine. It's fine. And you told me earlier that you're really enjoying your career at this time because of this newer field that you've
Yes,
yeah.
I'm loving the field because I get to practice medicine the way I like to practice, and I get to intervene into people's lives before they actually develop full-blown diseases.
Mm-hmm.
So I would like to attract more people that are into the anti-aging component from a nutraceutical and supplemental standpoint.
Mm-hmm.
But because I'm in the Chula Vista area, I think I'm going to have to do seminars where I educate people about the benefits of bioidentical hormones, about the benefits of resveratrol, all these things that are not really covered by our HMO or health insurance.
Mm-hmm.
And so I really like focusing on the prevention of disease,
Fantastic.
and influencing and weight management. Aesthetics is fun, but I'm just treating one component.
Seems like men this last decade